I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. An important aspect of men's health in their mature years is also about prostate. Prostate, a small organ of 15-20 grams in the younger age group, undergoes a change by bringing about changes in the urinary aspect. So the urinary flow happens through the prostate as bladder contracts and pushes urine. The prostate, being a static gland just below the bladder neck, undergoes change in terms of progressing in size. That's commonly measured by a sonologist. An ultrasound shows that 20 grams or 80 grams and 150 grams prostate. So prostate undergoing a change, visible to all of us on ultrasound, is the change in size of the prostate. But what does a man undergo is very important. And what does he undergo? He undergoes changes in the urinary flow as a result of change in the size of the gland. So urinary flow can gradually get compressed. The urethra, which going through the bladder gets to the bladder and prostate, undergoes a compression because of the occlusion happening as a result of the prostatic growth. So a 20 grams prostate also can cause an occlusion, and a 200 grams prostate can grow in size but may not cause an occlusion. A very important aspect of health which is missed out. In this prostate undergoing a change of size, which I did talk about urinary obstruction developing as a result of prostate undergoing a change. One change which happens on the other side is a prostate cancer. An hormone-related gland undergoing a change can also become cancerous. Prostate cancer is a change where men may not know about it. It may present as a prostate enlargement. It may present as bleeding in the urine. It may present as raised prostate-specific antigen or a PSA level. So PSA is an organ-specific marker which in few conditions can increase in its volume. So a normal PSA between 0 to 4 can change to 14 and 40 depending on the changes happening in the prostate. If it is an acute infection, urinary sensation, burning, fever, then it may be more of prostatitis and the PSA may go up, and therefore we don't do a PSA test. But in a cold situation of a health checkup or having seen your urologist for urinary complaints, an examination bringing about a change in PSA is an important aspect which we need to logically conclude and see what has happened. So friends, prostate cancer is not an uncommon cancer. The fourth commonest male cancer in India across the world is prostate cancer, which means an organ which is not visible here but hidden down into the body through which urine comes out can undergo a cancerous change. And this is not uncommon. Since era immemorial, men have gone through this change. Unfortunately, it was never picked up early. In this era where we live in around, era of artificial intelligence, era of awareness, era of safeguarding our health as men, it is important for us to look at our own health checkups from 40s onwards, where we need to evaluate and pick up if there's anything which is important. And prostate health is an important health. So friends, prostate cancer can be picked up by many ways, and the commonest ways are to be evaluated by a urologist. So urologist who is the bandmaster of the entire orchestra of prostate, examines you. He examines you by a clinical examination called digital rectal examination. He looks at your uroflowmetry and how the flow is, which is undergoing a change as a result of prostate change. He looks at your PSA level, and with all this he deduces something. So what does it mean? It means that there are prostate changes happening in men in 40s to 80s, and of which a subset of individuals could undergo a change which could be prostatic cancer. It can be picked up by digital rectal examination in some patients. It can be picked up by a persistently high PSA which is not decreasing down with antibiotic cover, and where the finger examination shows a doubt, and there is an MRI which actually gives us an idea and a scoring which tells us that our direction is this. So friends, when you look into prostate health and men's health, with an ever-changing prostate aspect which is happening from 40s to 80s, it's important for men to be aware of it. Your urinary flow going down, you having bleeding in urine getting completely blocked, you have been on medication and there's no result, and there is a change happening which is so uncomfortable. With all this, it's time for us to wake up to a phenomena that prostate health is undergoing a change. And from 40s onwards till 80s, the prostate will progress undergo change. So prostate cancer today can be picked up early in health checkups by examination by a uroenterologist, and he many a times will take it forward to the next level of identifying whether it's a localized disease or a spread disease. A localized disease is something which has been picked up early. So salute to you that you actually looked at the awareness, you identify you have a urinary complaint, you did a health checkup, the PSA perhaps was raised from maybe normal, your urologist examined you and picked up doubts, did an MRI, did a biopsy and proved there's a prostate cancer. Once that is proven around, it's all about logically concluding the disease. That means the prostate can be removed completely and the organ continuity of the urinary passage is maintained by a robotic radical prostatectomy or a prostate removal surgery in a localized disease. There could be diseases where the organ could be actually flared and there could be spread beyond the organ to various disease locations around, which could be a metastatic disease. In that situation, because it's a hormone-related gland, we bring about a control of that hormone-related issue and downstage the tumor completely. So friends, the awareness is important. It's not about any anxiety and worry, because as men, we'll undergo a change. And that change has to be picked up in time. Because there's no way a graceful aging can be stopped. If you are 50 today, you'll be 51 tomorrow, irrespective of what. And you'll be 55 and 72. So changes which need to be safeguarded, a lot had to be aware by us. That means we know what is happening to us. If we know that there's a urinary complaint, we won't keep waiting. We'll see our urologist in our cities and our towns. If we have got bleeding in urine, we'll never wait. If we've got a flow of urine which is not improving with medical management and we still keep taking medications, I think we're going to be in trouble. So identifying the prostate issues in time is all that we need to get. And unfortunately, it's a male phenomena. It happens to men who probably men may not pick up early, they may pick up late, or they pick up in time. So it's a job of an understanding between a patient and a urologist, which is about prostate health. The prostate health can be safeguarded. Safeguarding prostate health to bring about a maturity in its relative changes which are happening around by medical management, by identifying that obstruction can be treated medically or by surgically or by minimally invasive surgery, is all that is to be brought to individuals in society. Men in that prime of life, 40s to 80s, are busy. They are busy, they are not aware there are a hormone change happening. They wake up to a phenomena which is progressing only when it becomes too bothersome. Too bothersome of obstruction, too bothersome of leakage of urine, or too bothersome only when there's a bleeding or an obstruction to flow. All this happening and a urinary flow undergoing a change, there could be a parallel change in the prostate on the other side, which could be a prostate cancer. And therefore, let your urologist examine, let him pick it up. He picks up early, he picks up late, he probably takes you forward in the journey of treatment and cure. So prostate cancer is treatable, is curable. It's important for the society to be aware of this. And this attempt to awareness is an acceptance by society that men are concerned about their health in today's era. Thank you so much.